Good afternoon. My name is Catherine Manning, and I will be presenting my Capstone Project on Bedside Shift Report. Several years ago, the Joint Commission issued a Sentinel alert related to inadequate nurse handoff communication. Inadequate handoff can lead to many safety events, including medication errors, falls, and surgery mistakes. Bedside Shift Report was created to minimize safety issues and involves the patient and the family. It also helps improve quality of care, patient experience, nurse and patient satisfaction, nurse time management, and accountability. Consistent Bedside Shift Report will result in a positive social change by improving nursing performance and promoting positive patient outcomes. Bedside Shift Report can save lives. Nurse Bedside Shift Report is defined as the process of exchanging vital patient information, responsibility, and accountability between the off-going and oncoming shift nurses in an effort to ensure safe continuity of care and delivery of best clinical practices. It is the accurate and timely communication between nurses and also between nurses and their patients. Patient participation in the report is paramount to delivery of safe, high-quality care. When report is completed at the bedside, it allows nurses to visualize and assess the patient and the environment with better communication and patient involvement in care. The Agency of Healthcare Research and Quality defines Bedside Shift Report as an opportunity to make sure there is effective communication between patients, families, and nursing staff. It also explains that one of the rationales for Bedside Shift Report is the creation of an environment where patients, families, clinicians, and hospital caregivers work together to improve the quality and safety of care. Research has shown that when patients are the third voice engaging in decisions that impact their health, measurable improvements in safety and quality result. Bedside Shift Report has a direct correlation with improved nursing communication, patient satisfaction, patient safety, and quality of care. It also improves trust between patients and the nurse, reducing communication errors, and facilitates nursing teamwork, accountability, and respect. Traditionally, change of shift report has been conducted at the nurse's station or down the hall outside of the patient rooms. Bedside Shift Report is a fairly new idea for nurses today, but it originated in 1989 when it was implemented by Memorial Kettering Cancer Center in New York. Verbal report alone, without the patient's input, can impact safety if information is incomplete or communicated poorly because of interruptions or distractions. With making patient safety and quality of care focuses, hospital systems have started making changes in the traditional model to create a patient-centered system based on current standards and best practices. The Joint Commission created patient safety goals and to improve quality of care. The 2015 Hospital National Patient Safety Goal 2 is to improve the effectiveness of communication between caregivers. National Patient Safety Goal 13 is to encourage patients' active involvement in their own care as a patient safety strategy. The rationale states that communication with the patient and family about all aspects of care, treatment, and services is an important characteristic of a culture of safety. In addition to increasing patient satisfaction, compliance with these standards has also been shown to reduce costs to healthcare systems. The benefits include less paid overtime, decreased legal costs related to falls and medication errors, and the overall bonus of improved patient experience survey scores from the Hospital Consumer Assessment of Healthcare Providers and Systems. The setting. Centra Health is a regional nonprofit healthcare system based in Lynchburg, Virginia. The mission is excellence for life. Centra's vision is to be the most trusted provider of innovative healthcare. The values of Centra are patient-centered, integrity, and respect, drive for excellence, and teamwork. In 1987, Lynchburg General Hospital and Virginia Baptist Hospital merged to create Centra Health. Southside Community Hospital joined Centra in 2014, and Bedford Memorial Hospital joined Centra in 2015. Centra has 685 licensed acute care beds in the system. They employ more than 7,500 people and serve more than 480,000 people in Central and Southside Virginia. The hospital enterprise serves patients across 9,000 square miles, a geographic area larger than the state of New Jersey. Virginia Baptist Hospital also houses the Breast Imaging Center, Heartburn Treatment Center, Center for Wound Care and Hyperbaric Medicine, Sleep Disorders Center, and the Center for Pain Management. Central also owns Piedmont Community Health Plan with the fully insured membership of approximately 17,000 and the Central College of Nursing with campuses in Lynchburg and Bedford and the Central PACE program. In 2008, the Allen B. Pearson Regional Cancer Center was opened and it provides medical oncology and radiation oncology services for the region. Central Medical Group includes 450 advanced practice providers and physicians. It is a network of local family practices, primary care physicians, and specialty practices in cardiology, gerontology, neurosurgery, orthopedics, psychiatry, rehabilitation, and urology. Citrus patient care includes wellness and prevention, patient teaching and advocacy, recognition of disease and health, spirituality, and research. Physicians, registered nurses, and allied healthcare professionals function collaboratively as part of the interdisciplinary team to promote positive patient outcomes. Citrus patient care occurs through organized and systemic processes designed to ensure safe and effective care and timely treatment. The unit that will trial bedside shift report is a surgical unit, and it is in Lynchburg General Hospital. It's a 36-bed unit. Staffing ratios are 5 to 6 patients per registered nurse and 9 patients for each certified nurse assistant. Each shift also staffs 1 health unit coordinator. Day shift also includes a clinical quality coordinator and unit manager. The patient population is approximately 75% post-surgical patients. The unit cares for patients who have had general surgery, bariatric surgery, neurosurgery, and vascular surgery. The other 25% of the patients are medical patients who come to the hospital with infections, dehydration, failure to thrive, accidents, diabetic ulcers, and other complications. The physicians who take care of the patients are surgeons and hospitalists. Periodically, patients are also under the care of an internist. Literature review. Bedside shift report is not a new concept and is well documented in literature. Nurse studies support the positive impact of it on patient fall rates as well as patient and nurse satisfaction. Systematic literature review studies point out that implementing bedside shift report can improve the patient experience with care as related to nurse communication. Communication during transitions of care, such as nurse shift change, is very important for ensuring that the handoff is effective and safe. Allowing the patient and family to be involved in nurse bedside shift report gives them an opportunity to hear what has occurred through the shift and the next steps in the care. It also gives them the chance to ask questions and provide input through the care process. Bedside shift report is an opportunity to make sure there is effective communication between patients and families and nursing staff. One study found that more than 70% of adverse events are caused by breakdowns in communication among caregivers and between caregivers and patients. Studies have shown that bedside shift report improves patient safety and service delivery. One study showed a decrease in patient falls during change of shift, dropping from 1 to 2 patient falls per month to 1 patient fall in 6 months. After implementing bedside shift report, hospitals reported an increase in patient satisfaction scores and improvements in the nurse-patient relationship. Also, one study noted a sharp decline in the average number of call lights on by the end of shift change. Bedside shift report has improved nursing, staff, and physician satisfaction. After implementing bedside shift report, nurses have reported a better ability to prioritize their work or cases during their shift and an overall decrease in staff time. One study noted a decrease in overtime by 100 hours in the first 2 paycheck periods on a 32-bed general surgical unit. In another study, a 34-bed progressive care unit over a 2-month review of overtime demonstrated an $8,000 reduction directly associated with the decrease in time for shift report. American Nurses Association scope and standards of practice will guide us during this change of practice. The nurse administrator collects comprehensive data pertinent to the issue, situation, or trends and analyzes the assessment data to determine the issue, problems, and trends. The nurse leader will look at patient safety and quality of care trends when planning implementation of the bedside shift report. The nurse administrator identifies expected outcome for a plan individualized to the situation. The nurse leader will involve caregivers in formulated expected outcomes and will define the outcomes in terms of values, ethical considerations, environment or situation, considering associated risk, benefits and costs, and current scientific evidence. The nurse leader will develop a plan that prescribes strategies and alternatives to attain expected outcomes and will develop an individual plan considering characteristics of the situation. The plan will be implemented in a safe and timely manner. Documentation will include implementation and any modifications, including changes or omissions of bedside shift report. The nurse leader will provide consultation to influence the bedside shift report plan, enhance the abilities of others, and affect change, and will evaluate progress toward meeting outcomes. An evaluation of the outcomes in relation to the structures and processes prescribed by the bedside shift report and the timeline. The nurse leader will systematically enhance the quality and effectiveness of nursing practice, nursing services, administration, and delivery of services. Creativity and innovation in nursing practice will be used to improve care delivery and patient outcomes. The nurse leader will collaborate with all levels of nursing staff, interdisciplinary teams, executive leaders, and other stakeholders. There will be communication regarding care and services and the nurse's role in the provision of care related to bedside shift report. The leader will integrate research findings into the bedside shift report practice of change of practice. Considerations will be taken related to safety, effectiveness, cost, and impact on practice in the planning and delivery of nursing and other services. Leadership in the professional practice setting and in the profession will be demonstrated by engaging in teamwork as a team player and team builder. Communication plan. Frequent and effective communication is especially important during change. Communication should be strategic, operational, and individual. It is best to communicate the who, what, why, and how of the change. The overview or strategic reason for the change would be first. Communications include the vision of what is going to happen, the bedside shift report, how individuals will be involved, what is expected for them, and why it's important to the practice and the patients. Staff meetings will be held to solicit concerns, questions, clarification, and suggestions. Many mediums will be used so that everyone can be reached, including meetings, emails, huddles, and bulletin boards. When managing change process, the participation of those who will have to change is essential. It is necessary to consciously develop a team culture where everyone works toward a common goal. The vision of bedside shift report and the objectives of the specific changes should be clearly articulated. Developing and nurturing a team culture is an ongoing process that is founded on the climate of trust and mutual respect. Clear expectations of bedside shift report will be set. Caregivers will know what is expected of them, should understand the role of others, and should have a sense of shared accountability. Empowering each team member to work toward the goal in their own job, in addition to contributing areas in the team as a whole, is necessary. Team members should be invited to indicate areas in which they would like to take initiative. They need to see the vision for the future and what they can contribute. Implementation, timeline, and evaluation. Resources needed for bedside shift report will vary from hospital to hospital and unit to unit depending on the size and scope of what the outcome is. Staff involved in implementing bedside shift report include time for the point person and multidisciplinary team to identify needs and adapt bedside shift report. The trainers, a registered nurse champion per shift, nurse managers, and the implementation team who monitors and provides feedback during shift change for at least 2 weeks after implementation. The nurse bedside shift report strategy is flexible and adaptable to each hospital's environment and culture. Implementing this on a small scale is suggested. The unit it will start on is a surgical unit. The plan will be to identify lessons learned from the single unit pilot implementation, refine the approach, and then spread it to more units. This will allow the successes to be the pathway to broader dissemination and wide-scale change. Implementation will begin every 2 weeks on a different unit to ensure time for rapid cycle involvement. The first 2 weeks will be devoted to education, and the next 2 weeks will be for piloting the change. Champions will recruit additional staff members to help perform bedside shift report audits with feedback. Audits will occur every other day on all shifts during the pilot to help track the change. Auditing with feedback helps to identify any gaps in the expected practice and reinforce the change. Seeking feedback when performing audits will be helpful to identify unforeseen barriers to implementation or sustainability. Unit-specific barriers to doing the standardized bedside shift report tool will be identified and addressed by the champion. Education about the relationship between bedside shift report, quality outcomes, and nurse satisfaction will be emphasized. There are several aspects of bedside shift report to consider for nursing implications. First, implementing change includes initiation and sustainment, which is an ongoing process. Leadership support, project facilitation, and intentional spread are critical to success and sustainment. Additionally, bedside shift report needs to be patient-centered. Nurses need to consider patient preferences and their ability and interest in participating at the time. As patients become more involved in bedside shift report, communication improves between the patients and the nurses, opening the door for the patients to identify preventable errors, and ultimately improve patient safety. Second, expanding bedside shift report outside of acute care, such as to the emergency department and including patients in that handoff, is supported in the literature. Bedside shift report implementation takes a concerted effort by nursing staff, project coordinators, and leaders. Auditing processes, measuring outcomes, and disseminating secure bedside shift report as a standard of practice is vital. Most importantly, and the rationale for performing bedside shift report, is that it promotes the nurse and their patient to build a relationship. Bedside shift report provides the patient a sense of security. Having the incoming and outgoing registered nurses present allows patient and family questions to be addressed more thoroughly and in a timely manner. Continuity of care leads to trust, accurate information, and increased patient satisfaction. Biblical integration. Proverbs 3:5-6 says, "Trust in the Lord with all your heart and lean not on your own understanding. In all your ways submit to him, and he will make your path straight." We are to trust God with our hearts and not depend on what we know. As Christians, we should include God in everything we do and allow him to keep us on the right track. We do not always know what to do, but when we involve God in every step we take, we arrive to the right solution. When change takes place, like adoption of bedside shift report, we need to rely on God to help us with the change and keep us on the right track. Philippians 4:6-7 says, "Do not be anxious in anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Jesus Christ." As Christians, we can relieve our excessive worry or anxiety by praying to God. He promises to give them inner peace, which will help us cope with anxiety and protect our thinking and emotions. Change is difficult, but with God guiding us, he takes away our worry and anxiety. He will do this with this change in practice to bedside shift report if we follow him and rely on him. Thank you.